Members of Congress, my name is Ogunlana, and I'm currently a laboratory scientist for the Mayo Clinic. As an allied health professional, my daily goal is to provide the best quality healthcare for my patients. But the challenge that most healthcare workers face is providing that service and broadening it to as many patients as possible. Currently in the United States, there is documentation, which I would like to emphasize is compiled by the OECD, that despite large amounts of investment in our healthcare system, the national expectancy does not follow the relative correlation of a longer lifespan. I am here to discuss the evident utility of the OECD. Many roles in the system have their own incentives, adversities, and politics that hinder the harmony between these entities. For example, on a macroscopic perspective, we observe the tensions between the federal and state government. This is most evident in recent years via the topic of Medicaid and its expansion programs. The Obama administration created the Affordable Care Act to expand coverage to unmarried adults. The federal government promised financial coverage and tax incentives to leverage and entice the use of the program. When the option was presented, a fifth of state governments flexed their power and retaliated federal authority by declining the use. The dance was seen again with the discussion of the CHIP program made by the Clinton administration, and again with the Biden administration with the reinforcement of the ACA. Unfortunately, the dance of power within the government is reinforced and I would say inflamed with our population demand and skewed geographical distribution. The volume of healthcare institutions, staff, and technological resources are disproportionately higher in urban areas versus rural areas. This is a significant factor in regards to the discussion of financial allocation in both state and federal government. On a microscopic level, we see the tensions within singular healthcare facilities. An infamous conflict is that of the patient, which is seeking out the service, but is repeatedly faced with swells of financial burden, questions of insurance coverage, and lack of proximity that exacerbate access. On the other side of the coin is that of the physician. That role is faced with an impending staff shortage, which is said to be affected by the Affordable Care Act. In fact, the trend of staffing shortages is seen in multiple OECD countries. In that same breath is the nursing role, also facing a staffing shortage as well as unfulfillment in their work and struggle in transitioning into new career roles. While these two characters service to help the patient, there is role conflict because of the growing demand of patients and patient care, which adversely impacts healthcare workers in return. I do want to note, regardless of this tension, it is critical to acknowledge that the loss of one side, whether that be the patient or the healthcare worker, is failure of the system in its entirety. All in all, information like this shows the gaps and issues that are not easily recognized. Comprehension would not be possible without the compilation of data provided by these global, collaborative, and informative platforms like the OECD. The comparison of other OECD countries and the dissection of our own healthcare system will lead to innovation and guidance for the betterment of our healthcare system. We cannot improve upon our system without truly understanding and seeing the data provided by the OECD. Thank you.